Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. I'm here today with my friend Ashley, and we're going to be going over how to set up your bike to produce a pain-free workout, avoiding neck, low back, shoulder, and knee pain. Hope you enjoy. So, today let's talk about how to set yourself up on your bike to avoid aggravating your pain. Many people are enjoying cycling and bike fitness, but however, we have to make sure that the seat position, our handlebar position, and our body position is set so we don't irritate ourselves. Number one, the seat height. The higher the seat goes, it's going to naturally want to pitch our bodies forward so we're holding onto the handlebars at a more horizontal level. This is going to produce more stress on the shoulder and the neck, because typically if the seat is high and we have to go forward, we're going to have to look out. That causes extension, okay? Just like you see on the road bikers who are constantly in this posture. That crushes the back of the joints in the neck, the back of the discs, and can lead to muscle shortness and a lot of pain. However, when the seat is too low, if you have a knee problem, it's going to produce more of an angle at the knee and bother things like patellofemoral compression. If you have a lateral tracking disorder, a meniscus problem, an arthritic problem underneath the kneecap, that will also be irritated. So depending on what your unique situation is, if you have a knee, you'd want to be up as high as is comfortable. Typically at the bottom of the stroke, when your leg is at the lowest position, you want to have only a very slight bend to the knee. That's about as high as the seat will want to go in terms of protecting the knee joint. If you, by the way, have a disc problem, let's say, in your lower back, you will also want the seat to be low, because the more high the seat is, the more you're leaning forward. That's going to produce flexion or bending forward in the low back, compressing the front of the spine where the disc is, and opening up the back of the spine, overstretching. If you have a muscle strain, that could also irritate it. Again, if the seat is too high, though, and you're bending forward, that could relieve certain types of lower back pain, like stenosis and spondylolisthesis, because the higher the seat is, the more you bend over, it opens up the back of the spine, relieving pressure there. So think about what your pain situation is and adjust your seat height accordingly. Also on the pedals, a lot of people don't understand where their feet should be. While you're pedaling, ideally the center of your thigh, as we look at your body straight on, should be directly behind the center of your knee and the center of your ankle. Now Ashley has a pretty good position here. Her body just fits her pedals and her straps pretty naturally. However, someone with a wider pelvis, they're going to have to position their feet out a little bit more on the pedal. Otherwise, it's going to cause the knee to travel in. That's going to cause a knock knee or valgus posture on the knee, which can irritate meniscus problems, medial collateral sprains, chronic issues with patella problems, a whole host of other disorders. So make sure that your foot is positioned so that it's directly underneath your knee and looking at the body from a perpendicular standpoint. The center of the foot and ankle, the center of the knee, and the center of the hip are all lined up. Okay, now let's talk about handlebar positions. The lower the handlebars are, that works just like the high seat. Okay, that's going to be able to produce more forward bend, irritating a lot of neck problems and possibly lower back. The higher the handlebars are, it allows you to sit up a little bit straighter so you're not pitching forward. This is typically easier on shoulder problems, neck problems, and certainly lower back disc problems or lower back pain that's aggravated by bending forward. Once we get our seat and handlebar height set to a comfortable degree based on that criteria, we want to set our core. A lot of people biking just slump down and they allow their ribs to just kind of fall on the pelvis. That's only producing more disc pressure. Remember, the more that you sit, you're producing 13 times your body weight on your disc versus when you stand. So when we sit, we always want to make sure the spine is tall and that the rib cage is held up vertically off the pelvis. So we're keeping a maximal distance between the bottom of our ribs and the top of our pelvis. If you have a problem such as a tailbone being higher up than your pubic bone, which is called an anterior pelvic tilt, you want to adjust accordingly and tuck a little tailbone under. If you have a tendency to hip hike or hold one hip higher, or lean with your ribs to one side, or you have a postural tendency to twist to one side. You want to get the body square before you start pedaling so you're set in a good posture position. Holding the lower abdomen in helps to engage the transverse abdominis, and that will also help keep your vertical and your core set. The shoulder set before we start pedaling. You want to make sure the front of your shoulder blades are flat. This is a big problem with a lot of cyclists. They're going around the shoulder blades. That puts stress on the rotator cuff and the shoulder joint as well as the neck. So we want to make sure our blades are back so the front of our shoulders are flat. We want to make sure that our arm bone is centered in the socket. Now, a lot of people have an anterior or forward movement of their arm bone or a superior upward arm bone malposition in their shoulder. Again, if you're not sure about this, you can go to the Pain Free and Fit or Posture Size websites. We have a free body analysis to check your body out there and to learn how to correct your own unique posture distortions. So the shoulders are set in a good square fashion. The arm bones are held back and down in the sockets. And to reach the handlebars comfortably, we want to pitch our body forward. But when we pitch it, we're not going to pitch it forward from the low back. We're going to turn from our major joint, the hip joint, the ball and socket. Ashley is going to tilt her whole pelvis forward slightly on the hip. Do you notice how that keeps her back and her neck all straight? If she didn't tilt from the pelvis, she's going to tilt from the lower back. That's going to stress the back. So she maintains what's called a neutral spine, meaning a comfortable amount of tail up or tail down. She engages that core and she's going to rock forward from the hip joint, making sure that her ear, her shoulder, and her hip are all in a direct line, avoiding the other typical mistake of forward head posture. And now she's going to look at her Peloton screen or who's ever in front of her, beating her in the race on the street, and she's going to pedal away. And finally, while we're pedaling away, let's check one more thing, which is the mechanics of the hip joint. Typically, as we're going through the cycling process, there should be an equal display of force between the hip flexors on the front of the hip bone, which bring the knee up, and the hip extensors, the main buttock muscle that's driving the leg down. Unfortunately, a lot of people, because of chronic sitting postures and spending a lot more time flexing their bodies forward than bending backwards, have a weak buttock or extensor muscle and an overactive hip flexor. So as you're pedaling, it helps to engage the buttock by squeezing it slightly as you're pedaling. That can be enhanced by tucking the tail tension a little bit more using your abs, so you're getting more of a full body workout. Okay? That engages the buttock muscle, that slight little tail under tension, as if Ashley's trying to prevent me from pulling her pelvis and tail up. She's going to feel her abs contract. It's going to help her get more buttock squeeze, which is going to take that hip bone and keep it centered in the socket. Otherwise, many people have a tendency to anterior translate their hip bone forward due to overactive hip flexors. This keeps the hip in a nice biomechanical state, producing equal tension between the back of the hip muscles and the front, aiding what we call a nice force coupling mechanism on the hip, and prevents you from creating an anterior slippage of the hip joint, which many times leads to groin pain after you've been cycling, or tight hip flexors after you've been cycling. This will definitely help. So let's keep these tips in mind. Enjoy your cycling, stay out of pain, and stay fit.